Gentlemen of the media, good afternoon to all of those Bermudians who are either listening on the radio or watching from the comfort of their homes. Today I'm joined by the Minister of Health and the Minister of National Security, and I will give an update on the latest test results received regarding COVID-19, reiterate the serious ramifications of not taking the shelter-in-place orders seriously as a result of new modeling information which has come to the government, and provide an overview of the flights that have landed in Bermuda this week. The Minister of National Security will provide an update on items surrounding our shelter-in-place order and other specifics which are necessary to relay to members of the public. Before I start, I would like to express my appreciation to the Deputy Premier, the Honorable Walter Roban, for leading yesterday's press conference to allow me to get a day of rest. Allow me to begin on testing results. Today, the government received 25 test results as of 4:30 p.m. And of the 25 test results that were received, all of the results came back negative. However, it is my sad duty to inform the country that we had yet another COVID-19 related death today. On this occasion, it was an 80-year-old male who had been hospitalized and whose source of transmission is still under investigation. This is tragic for any family going through this, and I ask for the community's compassion in allowing the family time and space to grieve privately. With the 25 results that were received today, it means that Bermuda's number stands at 39. However, given that there are a number of test results that we're expecting tomorrow, it is the expectation that that number will rise. Out of the 39 confirmed cases of which we currently have, 23 persons have fully recovered, five remain hospitalized, and there are 8 active cases under public health monitoring. And as I reported earlier, we have 3 persons who have passed away with COVID, who tested positive for COVID, and one whose exact cause of death will be subject to a coroner's inquest. The average age for the confirmed positive cases and the median age for the confirmed positive cases still remains at 47. The average age of those hospitalized is 69, and of the 39 cases, 23 are males and 16 are females. Review of our overall testing numbers to date show that out of the 315 tests that we've completed, 39 were positive and 266 were negative. On behalf of the government and the people of Bermuda, I extend my condolences to the family and friends of the Bermudian who died earlier today in the hospital. And also, I'd like to extend the condolences of the people of Bermuda and the government of Bermuda for the Bermudians who are mourning the loss of a loved one who passed away overseas from this virus. Before I move on, I would like to note that the environmental health, vector control, and safety and health are all operational, with staff working full-time as essential services. And these essential services have been working and will continue to work and remain operational to keep the public safe. Regarding our existing shelter-in-place order, I personally, and as I said, Minister Keynes will be covering a number of things, but I have personally been disappointed with the sheer number of requests for exemptions from these rules. There is, in some cases, a clear inability to appreciate the gravity of the situation. So let me try to put this in perspective for everyone in Bermuda. As part of my briefing with the Ministry of Health today, I was able to review the modeling numbers which had been received. And it indicates very plainly and simply that if we do not follow the rules which are in place now, or the rules which will be necessary to implement in the future, the estimation is that over 700 Bermudians can die from this virus. This is not an error, and I am not saying this to scare anyone. These are the facts. And we have seen this take place across the world. They have seen their inability to flatten the curve. In Bermuda, we have acted early. However, if we are not taking this